For today's webinar, we are pleased to be joined by Karl Cooper, Director of Public Health Programs at American Association on Health and Disability. Karl will cover disability etiquette and basic accessibility considerations for anyone doing enrollment work, and he will provide an overview of questions a person with a disability needs to think about when considering their healthcare options in the marketplace. With that, I'll turn it over to Karl.
Thank you very much. My name is Karl Cooper, and I am with the American Association on Health and Disability. And for those of you who are not familiar with our organization, AAHD is located just outside Washington, D.C. in Rockville, Maryland. And it's our mission to promote health and wellness for people with disabilities. We do that through 5 main objectives. We work to reduce health disparities. We advocate for community inclusion. We promote full accessibility. And we work to integrate disability into the public health agenda. And we also work to advance knowledge translation and disability research. So before we get too far into the discussion today, one of the things I do like to start off and talk about right off the bat is about the disability population itself and what the health concerns are for our population, and specifically how it relates then to potentially things they need to be thinking about as it relates to health insurance. In terms of health disparities and who is a person with a disability and how we define that, according to HHS, 12.5% of the population has a disability which seriously limits them. Many times you'll hear a statistic in terms of disability of 1 in 5 or even 1 in 4 folks have disabilities. That is a much broader definition of the term. For purposes of the statistics that I'm going to be talking about in the next couple of slides, we're talking about a more narrow range of that definition. And that's a common question we always get is, how do you define disability? And it really depends on in what context you're talking about it in. So for instance, the broader definition would apply to something like, say, the Americans with Disabilities Act, where you want it to be broad so that most people have the protection. But for other things, it is a much more narrow definition. So for purposes of these health disparity statistics, we're talking specifically about that group that's more 1 in 8 or 12.5%, which has a disability which does seriously limit them. In this instance, these people with a disability are over twice as likely not to see a doctor due to cost. They're over 30% more likely to be obese. They are 60% more likely to smoke, and they are over 2.5 times more likely to develop diabetes. So you can see already that there's a lot of health concerns that are being raised by this particular population. And if you have a situation where someone is part of the disability population and another minority group that experiences health disparities, it's only usually magnified that much more. Some other health disparities: women with disability are less likely to have a current mammogram and a current pap test, so they're not receiving usually the preventative care they should and the screenings that they should. People with a disability are over 3.5 times more likely to have cardiovascular disease in the age group of 18 to 44. It gets a little bit better when you get to the ages of 45 to 64. It goes to just under 3 times. But that, of course, isn't because people with disabilities are getting better. It's because their counterparts without disabilities are getting less healthy. In terms of social determinants of health, which obviously have a huge impact on our health, people with disabilities have double the unemployment rate among those within the workforce. And that's a key distinction among those within the workforce. We're not talking about people with disabilities that are unable to work. We're talking about people with disabilities who are able to work. They still have double the unemployment rate among those compared to those that do not have disabilities. So generally and that tracks with regardless of how the economy is doing. So as the economy gets worse, it gets doubly worse for people with disabilities, and as it improves, but it improves, still at that same rate where it's still double the rate of the unemployment rate for folks with disabilities. About 35% of people with disabilities are likely to have less than a high school education, and they're also less likely to report sufficient social and emotional support, which of course does play a huge role in health decisions that are made if they don't have the folks around them that are helping with that. Whenever we do training on disability, we do like to talk about disability etiquette and some of the things that are do's and don'ts as it relates to people with disabilities and interacting with them. I'm not going to sit here and try and go through all of these bullet points that I have on here. I'm just going to hit a couple of the highlights. And keep in mind, and I'll be talking about this a little bit later in the presentation, that the main thing you want to think about in terms of when you're interacting with a person with a disability is just treat them with respect as you would anybody else. And generally, if you're unsure, if you ask a question, you can never go wrong. And that is much better than making an assumption. So some of this is common sense stuff, but a lot of times it does, there is things in here that we feel that we need to point out just to make sure that folks are behaving in a way towards people with disabilities that is going to be met with respect from that person, so that you can have a useful meeting when you're meeting with them. In terms of some disability pointers for people with all disabilities, you want to introduce yourself. People that do have limited use of their hands still will shake hands many times. You want to be asking if they need assistance before providing it. You don't want to assume that they need assistance. You want to speak directly to them and not to someone that's with them, whether it's a caregiver or family member or whatever. You want to speak directly to them because many times, most times, those folks will be able to interact back with you and tell you, how they're feeling, how they're doing, and any questions they might have. Moving on to some of the other pointers, in terms of people with mobility disabilities, you want to make sure that you're, not touching the person's wheelchair. It's essentially the same as touching a person. You wouldn't just lean on a person. You shouldn't be leaning on a wheelchair. And also, when you're talking with them for any length of time, try and bring yourself down to eye level to facilitate the conversation so the person's not having to look up at you. People who are blind or low vision, that's just an awareness of making sure they know what's going on around them, and that's what a lot of these bullet points have to deal with, is just making sure that you're thinking about those things and letting them know what's going on so that they are fully aware of their surroundings and what is happening. For people who are deaf or hard of hearing, you want to make sure you're getting their attention before you're talking and explaining interruptions. If a phone rings or something like that, they might not realize that. And ultimately, you want to find out the best way to communicate with them and communicate in the way that they want to have you do that. In terms of people with speech and language disorders, you want to make sure that you're not trying to finish their sentence, have respect, be patient, and making sure that you're going ahead and allowing them to complete their thought, even if it may take a little bit longer for them. People with cognitive or intellectual disabilities, you want to keep things short and simple. If you can use some sort of visual aid, that's always helpful. Ask if they have questions, or even a better option many times, if you want to make sure someone's understood it, is ask them to explain it back to you, because many times they'll feel pressured to answer yes if you just say, do you understand that? So rather than do that, sometimes it's better to say, how do you understand what I just told you, and allow them to explain it back to you. People with mental health or behavioral health disabilities, many times this is a little trickier because people don't necessarily self-identify with these issues. So you've got to many times pick up on some, nonverbal clues, see if they seem anxious or agitated. You want to make sure you're speaking calmly, break things down for them, and respect their choice. Some of them will say, I have a mental illness, or they may prefer to use a different terminology like mental health condition, or whatever it is, whatever terminology they use, that's what you want to use. Disability, accessibility, and accommodations, there's a lot here in terms of different things to be thinking about, and usually this is where I would spend a lot of time going through all these bullet points, but let's face it, in a COVID world, we are not doing as much in-person activities, so a lot of these things might not necessarily be in play this year, but they are still things to be thinking about if you are doing in-person things, making sure that the buildings are accessible, that they have access to an elevator, that there are clear paths cleared within a building so that if someone is in a wheelchair, they don't have a hallway that's blocked, that makes it more narrow where a wheelchair is not going to fit through, making sure that the restrooms are accessible, making sure things are available in alternative formats, whether that's Braille or large print, making sure that the font sizes for large print materials are large enough that someone with a visual disability that does still read is able to read them as long as it's large enough. And in terms of packaging and messaging materials, making sure you're including people with disabilities. And that would really apply for digital and in-person events, making sure that people with disabilities are identifiable in your images so that people know that they are welcome and you're able to serve them. But we are in a different world these days, and we did want to take some time to talk about COVID and accessibility, and specifically accessibility in a virtual world. And that does raise a whole other list of issues that we need to be thinking about to making sure that we are conducting business in a way that those folks will be able to be fully involved in, be able to be full participants in those. So one thing you need to be thinking about is having alternative formats for printed materials. And that's really also talking about not just, making sure that they are, some people are going to might want to have access to Braille, but most people that have visual disabilities, and if they are blind, they are going to use screen readers, and making sure that your materials are in a form that allows for screen reading. So let me give you an example. If you're usually in a Word document and you're creating something and you create it into a PDF, generally that document is going to be made screen reader accessible because the text is readable. But if you have a document and you just scan it as a PDF, many times that is not, because it's not going to pick up the text, it just makes an image of it. And when it's an image, the screen readers cannot interact with that. So there's usually a very easy test to figure out if a PDF is accessible or not. And that is, if you can click on the text and highlight the individual text, usually that means a screen reader will be able to interact with it. But sometimes, folks, it's just better to even provide a Word document, because those will absolutely be accessible and a screen reader will be able to interact with those. You want to allow for alternative means of participation. If you're meeting with someone on Zoom or something like that, have another way for them to be able to access it, whether it's a call-in function or something like that. You want to make sure that those alternative means for them to be able to participate in your event are available to them, so that they aren't limited to just one way. In terms of online images, you want to make sure that those have alt text available for any images that are on a website or a document or something like that. So if you are creating a PDF document that's going to be available for a screen reader and it has important information in it, you want to make sure that you use alt text. And usually if you're in a document, in whether it's PowerPoint or Word or whatever, if you right click it, usually you'll see an option there for alt text where you can add a specific language so that you can add that in and describe what's in the image. And I'll talk about that a little bit later in terms of one of the slides that I have, and I'll talk about how that works. In terms of, we all live in Zoom now, it seems like, so how do you make Zoom accessible? Well, first of all, I want to talk about captioning. Captioning is available in Zoom, and there's a few ways to do it, but you need to make sure that it is enabled in your program so that you can do it when you're hosting a Zoom meeting. So if you look at the screenshot I took here of a Zoom meeting, of their menu, you want to go in your settings, and their advanced settings in meeting advanced. One of the options is closed captioning, and you want to make sure that that is checked. If that is checked, then what you can do is when you're in Zoom, it will appear as an option. And if you are the host, you can then either do the captioning yourself, you can assign it to someone else, or there are third-party companies that you can specifically work with to, where they can follow along and provide the captioning for you. So those are all things that you can do to make sure things are fully accessible. What we generally recommend for this is, if you're doing a larger event, is ask folks if they do need something like that. If they need that accommodation, you can make sure that that accommodation is ready ahead of time, or specifically have it available as an option that you can add then if people are asking for it. In terms of other things in the Zoom accessibility, we want to talk about ASL interpreters and what you can do to make sure that ASL interpreters can be part of your a Zoom meeting, especially if you're hosting like a webinar or something like that that's a larger group. If you want to make sure that that is available, the way you can do that is if you have ASL interpreters, you can go ahead and have them turn their camera on, and they generally will participate just like anybody else. What we generally do, if there are ASL interpreters involved, what we usually do is we request that folks that are not speaking turn their cameras off, because what that allows then is someone who needs the ASL interpreters they can do the settings so that only people with their cameras are showing, and it hides the non-video participants. This allows them to see the ASL interpreters much more cleanly, and they can then obviously see who is doing the ASL interpreting, and it makes it a lot easier. So that's just making sure that that option is available, and that's generally what we tell people is, if you're not speaking, please turn your cameras off so the ASL interpreters can be more prominent, and that's generally the best practice on how to do that. Finally, the other thing I want to talk about in terms of Zoom accessibility is screen sharing. Screen sharing is obviously, we all do it, and it's a great thing to have. But one thing you want to do, if you know that there's someone that you're going to be speaking with that uses a screen reader, you're going to want to make sure that the screen sharing is done in a way that is accessible. And the ways you can do that, there's a few ways you can do that. Number one, a person with a screen reader can shut off anything so that it doesn't interfere with them being able to see everything else or hear everything else that's going on, and the screen reader isn't interrupting all the time. Generally, one of the best ways to do that is to send the documents ahead of time to the individual so that they can view those documents in advance, and the screen reader can tell them so they know what you're talking about when you get to it. The other important thing to do then is, when you are screen sharing, is making sure that people are aware what's on the screen at any one time, and just to verbally say, okay, right now we're going to turn to this form or whatever it is, just so they're aware of what document you're on, and it will make more sense to them, especially if they have viewed the documents ahead of time. Most of all, the most important thing, though, is we want to make sure that we're being flexible, and that's one of the things that we found out about this. I will say this is a new area. There's a lot that we're still learning about this. We're a national disability organization, and this is one of the main things we do, and we still don't have all the answers. So the one thing I try to make sure that people are aware of is, people with disabilities generally aren't going to expect you to have all the answers, but what we try to do is raise the issue so that you're thinking about it, so that you know what options are available to you and what you can do if someone does need the accommodations. So just making sure that you're reaching out to folks, asking them, hey, what do you need? Is there any specific accommodation we can make? Even put it on your registration form and say, let us know if there are any accommodations you need with respect to captioning or ASL interpreters, all those types of things, to make sure that folks then are able to fully participate in your event. And at this point, since this is a sort of a brand new area, and I know this is probably stuff that it's stuff we've never presented on for CBPP before, we wanted to take this opportunity to sort of stop and see if people had specific questions about this or any of the other pointers I shared. So at this point, we'll take questions.
Thanks, Karl. There aren't any questions at the moment, but as a reminder, if you'd like to ask a question, just click on the Q&A icon at the bottom of your screen and type your question into the box. We'll pause for questions once more at the end. Back to you, Karl.
Okay. Do you want me to wait and see if we get any, or do you want me to just move on?
Oh, I think you can move on, and then if we get a few questions, then we'll ask them at the end.
Okay, sounds great. So let's turn our attention then to disability and health insurance specifically. And when we're looking at the Affordable Care Act, we want to make sure we're understanding what is important for people with disabilities in the Act and what it does mean for them. And there are obviously several things that came out of the Affordable Care Act that were quite important for the disability community. One of those things was no denial of coverage for pre-existing conditions. That's the common one that everyone knows. But there's also other important provisions that were part of what are called the guaranteed issue clauses. And those include no cancellation of coverage due to serious medical conditions, and no setting premiums based on disability or chronic conditions. So in other words, it's not just that people with disabilities can't be denied coverage for pre-existing conditions. They can't be thrown off a policy because they're costing too much, or their premiums can't be set based on the fact that they are utilizing more healthcare than maybe someone else, which is obviously huge, because what good is a protection against being denied for pre-existing conditions if the insurance companies can just go ahead and price you out of the market anyway. So it's those three things altogether are really important. Some other things that are important in terms of what it means for people with disabilities: no lifetime monetary caps is another popular one that people know about, and it is important that we emphasize the word monetary. Monetary means just that. It's the dollar figure that the insurance company spends on you. There are still limits on services, therapies, devices, all that kind of stuff. So, the insurance company is allowed to say, okay, you're only allowed to go to X amount of physical therapy appointments a year, or X amount of mental health treatment, sessions a year, whatever it is. They are allowed to put those caps on services, just not the amount of money that they're spending. Also, the other thing the ACA does is it requires that every qualified health plan cover 10 essential health benefits, which is huge for people with disabilities. And I'm not going to go through all the 10 essential health benefits, but there are some that are really important for people with disabilities, including, making sure that people have access to prescription drugs, that services that they need, including physical and occupational therapy, speech language pathology, and those types of things are all covered. Lab testing is covered, preventative services are covered, mental health and substance use disorder services are covered. All of those things are covered under the 10 essential health benefits. And then the ACA also had many Medicaid reforms that were put in place, which includes expanding the program called Money Follows the Person, creating the balancing incentive program, and creating alternative benefit plans. Those first two are specifically important for the disability community, because basically what that means is that if you are on Medicaid, you can receive those services at home in a home and community-based setting, as opposed to having to live in a nursing home to get those. So you don't have to be in a skilled nursing facility to receive those, which is obviously huge for people with disabilities, because it means that they can live where they want and still receive the treatment that they need. I do want to talk about a project that we have that we started several years ago all around disability and the health insurance marketplaces, called the NDNRC. And so what is the NDNRC? Well, it came out of a concern of disability organizations and navigators disability organizations that navigators would not have a sufficient knowledge base to assist individuals with disabilities as they made their healthcare enrollment decisions. Several of these organizations began discussing ways to reach out to the navigators to provide technical assistance and better prepare them for assisting the population of consumers with disabilities. It's estimated when the ACA was passed in 2010 that 3.5 million people between the ages of 16 and 65 were uninsured and had pre-existing medical conditions and/or disabilities. So these individuals faced multiple options when they were enrolling in their healthcare decisions, including coverage through the ACA marketplaces, coverage through Medicaid in their state, either through a Medicaid buy-in program, Medicaid expansion, or traditional Medicaid. So it was the mission of the NDNRC to provide cross-disability information and support to navigators and other health insurance enrollment specialists, thereby ensuring people with disabilities receive accurate information when selecting and enrolling in insurance through the Affordable Care Act marketplaces. And who makes up the NDNRC? The NDNRC is made up of several partner organizations, which include, and you can see one of the things that we really think is important with the with the NDNRC is the cross-disability nature of the partnership. We've got a lot of different groups representing a lot of different disabilities that make this up. And the 10 partner organizations are, our organization is the lead partner, American Association on Health and Disability, but also includes the Association of University Centers on Disabilities, Autism Speaks, the Christopher and Dana Reeve Foundation, Disability Rights Education Defense Fund, Family Voices, the National Alliance on Mental Illness, the National Multiple Sclerosis Society, the ARC, and the United Spinal Association. So like I said, the NDNRC has an important mission statement, which I read a moment ago, and it really underscores the fact that we want to provide those of you that are doing direct enrollment assistance with the information you need to be able to help people with disabilities. And most of the resources, all the resources that we have developed are on our website. So you can go to nationaldisabilitynavigator.org and find all of the resources that we have that relate specifically to people with disabilities and enrolling. You can go to the website, you can find out information in terms of the drop-down menu has information about the partner organizations I just mentioned. You can get all the materials that I'm going to be talking about here in a minute, including our disability guide and fact sheet. We have a blog where we give, where we highlight resources and trends and stories, and we also have a news section. We have a regular newsletter that comes out every Friday, so you can go on here and sign up to get more information. A little further down on the homepage, you can find our state resource guide map, where you can click a state and get information that is specific to that state. You can also, I should point out, on the homepage there, it references our social media, so you can follow us on Twitter, which is just NDNRC. So if you're on social media, I would encourage you to follow us. But if you do click on a state, you get taken to the state-specific resource page, which has information about each state, what marketplace type they have, whether they've expanded Medicaid, if it's a state-based marketplace, the contact info for that, and some of the information, and including state-specific resources and state-specific news and stuff like that. In terms of categories, under the resources and links page, we have several different things in terms of our information that we can put out, that we put out under different categories, including enrollment resources that are disability specific. Many of these are from our partner and friend organizations, such as a toolkit from the ARC and draft questions on rehabilitation and habilitation benefits from the American Occupational Therapy Association. The enrollment resources, mental health and behavioral health, includes resources from SAMHSA, the National Council for Behavioral Health, and Mental Health America. Enrollment resources of populations with special healthcare needs includes resources from organizations that are outside of the disability world, but still would have information specific that might be important to people with disabilities, including the American Heart Association and the National Health Council. The enrollment resources for ACA Marketplace and Medicare and Medicaid have resources from CMS, as well as organizations that are specific to each program, such as the National Council on Aging and Justice and Aging for Medicare, and the National Academy for State Health Policy for Medicaid. Enrollment resources overview is our largest category, and has a lot of different resources in it, including links to the Georgetown University Center on Health Insurance Reforms. They put out a guide every year that provides a lot of great information that's helpful for navigators. If you're not familiar with that, I would highly encourage you to check that out. Enrollment Statistics provides information regarding enrollment numbers as it relates to the marketplace. ACA resources in the government includes basic resources from healthcare.gov, HHS, and CMS. And from enrollment resources includes links to organizations that have been assisting and encouraging enrollment. I mentioned the disability guide earlier, and one of the it's an important document that we put out. It's probably the one we're most proud of. It was released initially in December of 2013. It has been updated since, and it provides sort of a 101 of disability information, including, it answers questions like, what are the purposes of the Supplemental Disability Guide? Some key questions that navigators need to be thinking about. Who are people with disabilities and what problems have they historically faced? How do disability rights laws affect the operation of the marketplace? What do navigators need to know about disability? And how is and actually, I'm going to go on to the next slide then to talk a little bit more about this. What do navigators need to know about disability has a bunch of different questions that I think are really important, such as how is disability defined? Some of the basic information that I was talking about earlier in terms of the broad definitions of the ADA versus other disability designations, like for programs like Medicaid. What disability questions appear on the streamlined application for health insurance or Medicaid through the marketplace. This is a section that addresses the section of the marketplace questionnaire which asks specifically about disability and what that means, and I'll talk about that more in a little bit. Why is understanding disability important? Navigators and enrollment specialists need to understand how disability not only affects choices that people with disabilities face in enrolling, but also how the navigator needs to make sure they are doing everything they can to provide services for people with disabilities. What is disability literacy boils down to making sure that organizations have awareness of disability. What is disability etiquette? Once again, can be summed up in one word, which is respect. Don't make assumptions about people and be careful what language you use. And as a person with my own physical disability, I'm always more than willing to discuss this in greater detail if you have questions at the end of the webinar today, or if you want, you can email me. My email address will be at the end of the presentation. What is physical accessibility? Addresses basic physical accessibility issues that are critical to making sure that all consumers can utilize the services of those who are assisting in enrollment. How can navigators ensure effective communication? Physical accessibility is not the only issue that you need to be thinking about, making sure that you can communicate with those individuals with visual and hearing impairments. And this section provides some of the basics and what you need to think about with that. And then the last two sections, how can navigators assist people with disabilities evaluating the adequacy of provider networks, and how can they assist people with disabilities evaluate the adequacy of the essential health benefits? Starts to get into some of the basic considerations that people need to be thinking about, and those are also spelled out more in our fact sheets, which is the next thing that we'll talk about. In year one, we released 16 fact sheets, and I'm not going to sit here and read all of these, but they do have a lot of different helpful information in a lot of different specific areas and how it relates to people with disabilities. So we've got the first 9 here, and then the next 8 here that deal with a lot of different issues. A lot of the stuff I talked about, those pointers I had on disability etiquette, you can find all those in that disability etiquette fact sheet that's listed under disability etiquette number 17. All of these fact sheets are available at the specific link at the bottom of these 2 pages. Then we also have another list of another group of fact sheets that are population specific. So what to know when assisting a consumer with and then a specific condition. And we had these, we had help from our partner organizations write these so that they were written by specific disability organizations that are familiar with these disabilities and have direct, direct contact with those folks, and many times are just organizations made up of individuals with those specific disabilities. So I do want to take a little bit of time out just to go through some basic things that we need to be thinking about when we're helping people with disabilities in terms of specific issues that might come up. This is not meant to be in any way sort of a all-encompassing discussion. Rather, it's just hitting some of the highlights, and then I'll tell you how you can get more information on all of these. And I like to talk about, when we're talking about helping people with disabilities, I refer to it many times as health insurance jeopardy. For those of you familiar with the Jeopardy game show, you know it's not about the answer, it's about asking the right questions. So making sure that the people with disabilities are asking the right questions is critical to making sure they're getting the right coverage and getting into the right plan. So I'm not going to go through all of these, but I do want to hit a highlight from all of the different ones in the single Jeopardy round that we have. So in prescription drugs, we'll go ahead and take a look at the $200 question. The individual tells you that he has tried generic drugs before and that they were ineffective. So what's the question? Does the qualified health plan require a patient to try a generic drug first, which is commonly known as step therapy, because many times that will not work for them and they might want to consider a different qualified health plan. Moving on to medical devices. The individual uses a motorized wheelchair and complains that her current chair won't keep a charge. If that's the case, then the question is going to be, does the qualified health plan cover the repair of DME or replacement parts for DME if it's getting a new battery or something like that? I said earlier about the 10 essential health benefits. Medical devices are one of those, but medical devices is not a defined term, and states and insurance companies have defined it differently. As long as they're covering something, they're technically in compliance with the ACA. So many times we've got to make sure that we're getting to the bottom of exactly what it means when it says that this stuff is covered. Many times it is, but sometimes it's not. Let's move on to rehab and rehabilitation benefits. Consumer uses rehabilitation therapy and says that she has to go repeatedly for it to have any lasting effect. In this instance, the question is, does the qualified health plan put limitations on the number of rehab visits? I mentioned earlier that they can't put monetary caps on, but they can put service caps on. So lots of times this sort of preventative therapy that they have where you're just trying to stave off the problem getting worse. Insurance companies don't like to pay for indefinite rehab. So finding the plan that's going to cover that the most for that individual might be one of the most important things that they've got to look at. Let's look at rehab and habilitation benefits again. And a family has a 4-year-old child who is nonverbal. In this instance, you need to ask the question, does the qualified health plan cover speech therapies? And I point this one out specifically because, as you recall, the name of this category is rehab and habilitation benefits. Those many times are the same thing, but they're different things. And the reason I say that is you talk about covering speech therapy. In this instance, for a 4-year-old child who is nonverbal, it's going to be a habilitation benefit. The child never had the ability to speak and is trying to gain that skill. So in that case, the speech pathologist is going to be a habilitation benefit. Now, if that same speech pathologist is performing speech therapy with someone who's a stroke victim and lost their ability to speak, then it's rehabilitation benefits. And even though it's the same provider providing similar services, it's dealt with differently by many insurance companies. And knowing that difference is important, because just because they cover it for the stroke victim does not mean they're going to cover it for the 4-year-old child who's never spoken. And that's an important distinction that you need to be thinking about. Medicaid eligibility. When completing the enrollment on the exchange, you arrive at the question regarding disability. And it's a common thing that we talk about all the time, and making sure that people are answering this question correctly. Because the question you need to ask here is, does the individual want to apply for Medicaid? If the individual knows, because of a state's income requirements and all that kind of stuff, that they are not going to qualify for Medicaid, many times, even though the person has a disability, you want to answer no on this question, because otherwise, if you answer yes, it will have to go through the Medicaid eligibility process. They're going to get denied because of even if they have the disability, they might get denied anyway because of their income. And that could potentially cause a delay in them getting coverage. Now, they would still have a special enrollment period if it goes beyond the open enrollment period, where they could then get coverage. But in the meantime, it might not be until January that you hear, and then suddenly you're applying and they're not going to have coverage until February, and you've now lost a whole month where they're not going to have health insurance. So asking the question of whether or not the individual wants to apply for Medicaid is critical. Talking about the summary of benefits and coverage. The individual has a condition that requires that she takes drug X. And in this instance, we need to ask, does the summary of benefits and coverage say what drugs are covered and what the drug copays are? Obviously, a very basic question, but making sure you're checking the summary of benefits and coverage and the drug formularies are really important, and making sure that they understand how the copays interact with that. Finally, mental health, and this is the great unknown, which is why we leave sort of the blank slide. In this instance, the question is, does the individual need coverage for mental health, as they may not self-report that to you? If you're not taking care of, asking the questions that are important to make sure that they get it, this might not be something someone tells you. A common way we generally encourage people to approach this is asking folks, what providers do you see? What drugs do you take? Because that will get them talking about it, and is an indirect way to sort of ask the question without coming right out and asking the question. Double jeopardy. I'm not going to go through all of the specific things that are included in this, but I do want to show you sort of what the categories are, and I'll tell you in a moment how you can access all these and go through all of them if you want. But I do want to talk about the accessibility ones, since we were talking about that earlier, and we'll go through all of these accessibility ones. So accessibility for 400, this is the one thing you need to think about when assisting a consumer with paralysis. And the question is, what is building accessibility? Making sure your building is accessible for someone in a wheelchair. The next question for 800, this is the one thing you need to think about when assisting a consumer with multiple sclerosis who has low vision. In this instance, the question is, what is having material available in alternative formats, i.e. large print, so that you have those documents that are available in large print. Customarily, large print is defined as 18-point font or higher. In terms of accessibility, for 800, this is the one thing 1200, this is the one thing you need to think about when assisting a consumer with intellectual disabilities. As I was saying earlier, the question here is, what is asking questions that verify the person understands the information, and not just asking them, do you understand? As I said, many times they'll feel like they need to respond yes when you ask it that way. The $1,600 question, this is the one thing you need to think about when assisting a consumer with mental illness. And this is what is educating yourself about mental health conditions and making sure that you have an idea of some of the best ways to interact with these folks and be respectful and understand exactly what it is that you need to do and make sure that they're getting appropriate coverage and care that's going to be able to provide them the assistance they need. And then our final accessibility question, this is the one thing you need to think about when assisting a consumer who is deaf or hard of hearing. In this instance, the question is, what is the individual's preferred method of communication? And knowing exactly the way that they want to interact with you and then being respectful for that. And our final Jeopardy category is disability etiquette, and I've said it already a few times. So this is the one word that sums up the best quality you can have when dealing with anyone with a disability, and hopefully, if you've been listening, you know the answer to this one already, and that is, what is respect? If you do want to look at all of these videos, I would suggest you go to our YouTube channel, which you can find the link to it on this slide. Health and all these categories have been divided up into individual segments, so they're anywhere from, I think, 3 to 6 minutes or something like that. So I would encourage you to go on there and check those out if you want to go through all of them. A lot of helpful information in there that deal with a lot of the stuff that's in our fact sheet as well. We do have outreach resources available. Community Catalyst, we're working with them again to do outreach for open enrollment, and there's lots of different outreach resources. If you're trying to find imaging to use on social media or whatever to let people know that open enrollment is almost here, or when it is here, that it is. And this is, so these are an example of some of the stuff that you can find in there. Today marks 10 days to go till open enrollment. And we also see there, the dates in another one. And I talked earlier about alt text. So for instance, what should you include in an alt text? So these particular images, I do have alt text for them in this presentation. So if someone was using a screen reader and they came to these images, it would read to them what is in there. So for instance, for the first image on the left, it says, the alt text reads, picture of male leg amputee in wheelchair smiling with his arm raised with message that open enrollment goes from November 1 through December 15. And then on the right, that alt text for that says, young African-American woman smiling with the message that open enrollment starts November 1, 10 days to go. So it's simple, keep it simple. You don't have to get into a lot of description, but just basically describe what is in the image, and if there's any message that's written on it, that's essentially what you want to try and include in your alt text. If you want to have access to the Community Catalyst Outreach Hub, I'd encourage you to check out our newsletter. We include a link to the Outreach Hub every Friday when we put that newsletter out, and they are all archived on the NDNRC website at the link on this particular slide. Other projects that we have, I do want to talk specifically about the Health Insurance Literacy Academy that we've developed. The Health Insurance Literacy Academy is a project that is funded by NIDLR, which is an agency within HHS. NIDLR stands for the National Institute on Disability, Independent Living, and Rehabilitation Research. And one of the things that we did, that program, that agency is funding us to do is run the program called the Health Insurance Literacy Academy. And the HILA, as we refer to it as, is developing, implementing, and evaluating health insurance trainings for SIL staff so that they can empower people with disabilities to make informed decisions regarding private and public health insurance coverage. For those of you unfamiliar with SILs, CILs, it stands for Centers for Independent Living. The SILs are organizations all across the country which provide, essentially they act as a resource center for people with disabilities. They are funded through a couple different programs through HHS to provide peer-to-peer counseling for people with disabilities, advocacy for people with disabilities, and they essentially provide a vital local resource to these folks. But many of them have done a lot of work with Medicaid and people with disabilities, but not as much on health insurance. So we are developing a curriculum around providing training to them so that we can train them and so that they have more they have better understanding of health insurance and have that literacy that they need to be able to really help people with disabilities when they come in with those kind of questions. So that is something that we are working on. We've got the curriculum almost done on that. We are going to start doing some of those trainings in the next few months. So if you sign up for our newsletter, I'm sure we will be saying when those trainings will be coming out. So if you do know someone that does work in a SIL and maybe is helping with people with disabilities, I would encourage them to go ahead and check that out. Early on, we are trying to keep it to SIL staff, but ultimately, if the trainings are effective, we want to make sure that we are opening that up to other folks that do enrollment that have a disability background that might not be as familiar with health insurance. If you want to stay involved with our programs, I would encourage you to sign up to receive the updates from the NDNRC. You can do that on our webpage. There is a place to sign up for it. Like I said, you can find our archived newsletters there at the second link. You can also sign up for AAHD's newsletter, my organization's newsletter, at the third link there. And we also have a resource center that deals with a lot of different information, specifically on disability and public health, and a lot of stuff out there. If you're doing work with the disability community, I would encourage you to check that resource center out as well. And I see we have about 10 minutes left, so I am willing to open it up to discussions and see if there's any folks that have any questions about it. Like I said earlier, my email is on this contact slide, so feel free to reach out to me if you have specific questions afterwards that you think about, and I will be happy to help, or if there are any questions now, I'm happy to take any.
Thanks, Karl. We do have a couple questions. I'll just remind everyone, if you'd like to ask a question, click on the Q&A icon at the bottom of your screen. So if you could go back to slide 17, we have a question specifically about that slide.
All right, let me see if I can get to that.
Thanks. And the question was, there were 3 bullets about Medicaid benefits. So the question was, could you please explain a bit more about what those benefits are?
Sure. The Medicaid reforms that were part of the Affordable Care Act, there was a program called Money Follows the Person, which was an initial program that was actually started, in the early 2000s, and the Balancing Incentive Program was created under the ACA. But both are very similar programs. What they do is they allow their states to essentially earmark money that's funded at a different federal matching level that really encourages the states to provide care for folks with disabilities in a home and community-based setting as opposed to a skilled nursing facility. So that's what those two do. It also allows states to create an alternative benefit plan. The alternative benefit plan, and this is going to vary from state to state. So my knowledge specific to what every state has done on this is I as a national organization, I do not have this information. I just know generally what the states are allowed to do. And that is they are allowed to develop an alternative benefit plan that maybe would assist a consumer group with a specific disability or with a specific condition and really apply to that group. And it allows the states to do that so that they can, if they want to earmark Medicaid dollars to really help a specific group, maybe it's ones with mental health, or maybe it's ones with substance use disorder or something like that. Those are the ones that, that's one of the ways they can do that is by creating an alternative benefit plan that focuses the services in those areas as opposed to maybe other areas. And that's going to be very state specific, and you would have to check with your own state Medicaid office to find out if your state has done that, and if so, what it means.
Great. Another question we had was about the resources you have available on your website. Do you have the state level data on number of individuals who apply for coverage on the marketplace and have a disability? And do you also have the data that's broken down by the kind of disability and the age of the individual?
Those are great questions, and I wish I could answer that in the affirmative, but we do not have that information. The problem is there's no good way to judge that. Since as I talked about in the presentation, there is limitations on what the marketplace allows us to do, because if you look specifically at, for instance, the questionnaire on healthcare.gov, it asks about disability, but then, as I explained, you're going to want to answer that question no if you know the person's not going to qualify for Medicaid. So we can't go by how people are answering that question, because it's not going to be a true indicator. So there's no definitive statistics. I know that we worked with a project that was funded that actually just ended this month, but had gone for 5 years, called the Collaborative on Health Reform and Independent Living. It was a project out of Washington State University. Collaborative for Health Reform and Independent Living is CHRIL, and you can go to CHRIL.org. And I would encourage you to check it. They have a lot of different information there in terms of surveys they've done and stuff like that, because we recognized that you couldn't get the information off the healthcare.gov questionnaire. It was going to have to be gotten through other survey data and stuff like that. So they've done a lot to try and get some of that information, but ultimately there's no one place that you can go to get that answer.
One more question about the resources on your website. Do you have information about that would help people apply for disability benefits or figure out if they qualify for disability benefits?
I'm assuming you're talking about like Medicare, like Social Security disability?
Yes, I believe so.
Yeah, that's not an area that we specifically work in as a national organization, but there's a lot of stuff out there. So I can certainly see if there's something that we can forward along to you that you could include, but that's not an area that we work in specifically.
And the next question is mostly a comment, but asking for your guidance. So oftentimes when contacting the marketplace, assisters will see there's a 2-week wait for ASL interpreters. Do you have any suggestions on what to do in that situation so a person who needs an ASL interpreter doesn't have to wait that long?
Yeah, there's no easy answer to this question. The one thing I would encourage those of you that do enrollment work, if you are involved in the hiring process, is think of ASL like you would any other language. So if you try and hire folks with Spanish, where they can speak Spanish, fluency, that's the word I'm looking for. If they have fluency in Spanish, then I would consider ASL to be another language that way, and really think about when you're hiring folks, look to see and make that something that maybe is a consideration for when you're hiring folks. And if you see someone does speak is able to use ASL, then I would suggest maybe hiring them so you don't have to even worry about that. You've got someone on staff that can do it. I know that's what a lot of, when I talked earlier about the Centers for Independent Living, I know that's what a lot of those organizations generally do, to be able to communicate with that, specifically with that audience. So I would suggest doing that so that you can go ahead and just have your own folks do it. If you're not in the position of hiring folks, maybe you make a recommendation to the people who are in your organization. Say, hey, have we even thought about ever looking specifically for people that already know ASL that we could hire on staff, so that when we do get someone that uses it, we can just use them directly. That would be the suggestion I would look at long term. Obviously, that might not help you immediately, but in the long term, that might be an answer for you.
Great. Well, thank you so much, Karl, and thank you everyone for your thoughtful questions. So as a reminder, we'll be distributing the materials from today's session via email tomorrow morning. So please make sure you're signed up for our email list. And you can check out our website for the recording as well at www.healthreformbeyondthebasics.org. And if you have questions or need assistance, please email our Beyond the Basics contact email at beyondthebasics@cbpp.org. And with that, we'll bring today's webinar to a close. Thank you again for joining us today.